I mean, seriously, don't get me wrong. Like, I don't know. I love to dress up and be cute, but I don't know. Something about scrubs is just so much easier. Hello, everyone. Welcome back to Blink Collective. I'm Lisa.
And I'm Mackenzie, and today is a really exciting episode because we have our first official guest on the podcast.
Which feels very on brand for what this is supposed to be. Not just us talking, but bringing in more voices and perspectives.
Exactly. So today we are joined by Kylia Ellison. She is a third-year student at PCO and currently on her first externship. She might also know her as Eye on the Prize on Instagram, where she shares everything from optometry school life, tips for pre-optometry students, eye care recommendations, and her scrub outfits, which are always a moment. She's even partnered with brands like Fabletics Scrubs and OAT Booster.
Yeah. Honestly, I feel like your page too is such a good mix of like everything, like educational, but also super like real and relatable, which we love here.
Yeah, we're so excited to have you on. So thanks for being here.
I'm excited to be on. Thanks for having me, guys.
Yeah, welcome. Thank you so much for being here with us today.
And before we go any further, congrats on surviving through sitting through the part one for the first time, because that is just a defeat in itself. So
yeah, congrats. I bet it feels really good. Probably super relieved at the moment.
Yeah, thank you so much. Felt really good leaving out of there, but yeah.
Good.
Yeah, good. Awesome. Okay, we talked about this in the first episode. So, Kylia, this is your moment. Mackenzie.
Why optometry?
Yeah, so my answer is always so long-winded, so I'm going to try to make it short. But long story short, when I was a senior in high school, I was trying to start to think about, like, what am I going to do? And when I go to college, like, what am I going to major in? Things like that. They started a pharmacy program at my school, and they were telling me, like, even if you're not interested in pharmacy, just do it because they're going to talk about everything. So I did it. And when they talked about optometry, I was like, why have I never thought about actually doing this? So I shadowed, did all that kind of stuff, worked as a tech, and I loved it. And immediately was like, I can do this. Like, I can really see myself doing that. So that's kind of what got me started.
Perfect. We all kind of started out as techs, I guess. So
I know, literally, yeah. Cool. Both Mackenzie and I tech, so we all got a similar start to our why.
Yes. Yes.
Okay, so since this is Blink Collective, we have to throw you straight into one of our favorite segments, which is the hot takes.
Oh, yes. There's no easy in here. We are diving straight into the deep end. So, Lisa, do you have a hot take?
Okay. So, I don't know. I feel like my hot take, a lot of people might feel like one way or the other on this one, but I'm going to go for it. Are you guys ready?
Mm-hmm. We're ready.
Okay.
Give it to us.
So my hot take is I didn't go through all this schooling just to be uncomfortable in business casual. Said it. I said it.
Okay. I can relate to this one very heavily, and I can't even explain my thoughts on this. Like,
I mean, seriously, don't get me wrong. Like, I don't know. I love to dress up and be cute. But I don't know, something about scrubs is just so much easier. There's literally no thought in the decision. Yeah. You just wake up, throw on a set of scrubs and your comfy little tennis shoes, and you're literally set for the day. That's what I love about it.
That's exactly what I was going to say. I don't want to think about what I have to wear in the morning. I don't want to have to think about it the night before.
Yeah.
No. And like, even like washing clothes and stuff, like you don't have to think about it. You just throw them all in and it doesn't matter. Like nothing's going to happen to them. They're great. And it's just, I don't know, the stress of in the morning, like already having to do your hair and makeup and then like staring at your closet. My room would be a mess every day because when I try to put on a real outfit to like go out anywhere, I try on 50 before I'm ready to leave. So I would just be living in a constant pile of clothes on my bed.
Exactly. No, I love wearing scrubs, especially with the new colors now. I feel like there's so many good colors out there. So it makes them a little bit more fun. We're not just wearing gray and black anymore. So
No, exactly. I know.
At school. So for anyone who went to PCO, we have to wear
graphite gray.
I think it's the most ugly color ever, but maybe that's just me. But it's this color from Figs, and it's called graphite gray. And I just hated wearing gray every single day.
I know.
Dull.
It's so dull and it's so depressing because like the preceptors have on black, we have on gray. But I will say, so one of the students that is an extern at my site right now, she's from SUNY, and I guess they wear SUNY blues, so they wear like the royal blues, and they feel the same way about their blue. So I think everyone just has like a trauma, like hate relationship with their scrub color for their school. So
yeah,
and then just has to be the worst. Yeah.
Yeah, I guess that makes sense. Yeah, maybe we're just like trauma bonded with the gray and just like never want to wear it ever again. I literally leave those, like I'll always bring a pair on my externships just to have like an extra set in case I do laundry a day too late. But I usually choose not to wear the gray.
Absolutely. Yeah. I don't have enough color ones yet, so I'm like going every other day wearing the gray.
Yeah, that's how I was in the beginning. I still had to wear some of my gray, but then I was like, gosh, I gotta stop wearing these.
Yeah, it's nice to not have to wear them. But Kylia, you like to wear, like I feel like at school and stuff, like in clinic, you would put on a nice outfit every once in a while. I never did that. I always wore the scrubs, but
that was just because our little section, we like to do the most. So every time we had like the first thing of class or like the last day of clinic type thing, we would just dress up for that, just to celebrate that.
Yeah,
it was nice to switch it up a little bit.
Yeah. And I guess our class was just lazy. We're like, scrubs it is today.
Yeah, it's fine. I mean, I think it is. I mean, the job that I am going to, I can wear scrubs, but they prefer I wear business casual. So I'm gonna have to like go shopping for a new wardrobe, but it's okay.
I think I will too, which is fun, but also like expensive. And I'm just thinking about how much money I'm gonna have to spend on like all this business casual stuff, which kind of stresses me out. But I feel like I just got to find basic things that you can mix and match, you know?
Exactly.
Yeah, for sure. And I feel like it won't be bad in like the summer months, but the winter, which I will be in North Carolina, so it won't really be that cold, but I don't know. Just like it's easier in the winter, just throw on your scrubs and your big old jacket and head out the door.
Exactly.
Well, some of us will be in Pennsylvania where it's really cold, so I won't have the luxury of being in warm weather in the winter time.
Yeah.
I'll be more like Lisa, probably back at home in the DMV area, so it'll be cold.
Yeah. And I'm just gonna put this out there because I guess I'm not totally against wearing business casual to work, but I went to Catholic school for 13 years of my life, so I'm so used to wearing like a uniform. So I'd wake up every single day and I'd put on the same thing, just like different color variations.
Yeah.
So I just feel like I'm used to having the decision kind of like made for me, and I think that's why I just love scrubs because I don't know. I guess it feels like my olden days.
You're used to the uniform life. Yeah. You have no creative ability and you retire on the day.
Literally. I need a stylist if I'm going to wear business casual every day.
I just feel like I don't have the energy to wear business casual every day. And heels, being in heels every day, it's not happening.
Okay, no. I can't with the heels. And I feel like finding comfortable like business shoes is probably the most difficult part.
Yeah.
Because they have the flats. It's like, it still hurts. Like I have very flat feet, so.
Yeah. And like you get a little bruise or blister on your heel, and it's just like, I don't know.
Yeah.
Maybe we should all work together and invent comfortable business shoes.
Yeah, literally. I think we should. I mean, even when we went to like conferences and stuff like that, we'd literally wear heels like or something like that the first day, and we'd be walking back like limping because we'd get like a blister on the back of our foot or something. And it was just so uncomfortable. Like, I hate doing that. It's awful.
It's fine. It is what it is. But at least, you know, we can mix it in, have a little fun. We can still wear what we want. And maybe we should just go for like 3 days scrubs and 2 days business casual. Or, I don't know.
I kind of like that.
Yeah,
I like the like mixing it in.
Yeah, you know? Me too. Okay, so I feel like we figured it out then, right? Like, that's just what we should do.
Yeah, I think we should just send out a public service announcement, like, this is what every office should do.
This is the requirement for every single person.
Yeah.
Literally.
I do think guys have it better, though. Like, their outfits are one of these khakis or some kind of colored pants and a button-up shirt. That's easy. Yeah. And their, like, business shoes are basically tennis shoes. They can't be that uncomfortable.
I know.
But we can't get away with doing that.
No, we can't.
No.
Higher standards. It's fine.
Yeah.
Okay. Well, I feel like that was a good hot take, Lisa. I really like that one.
Yeah.
Kylea. Yeah. I know you have to have a good hot take for us.
Definitely. I feel like mine, for me, I've been thinking about this a little bit. And I'm like, your confidence it definitely matters as much as the knowledge that you know.
That's a good one. Yeah.
I like that. Honestly, I love this. I kind of 100% agree. I feel like we've all seen people who aren't even like maybe the most qualified in the room, but they speak with so much confidence that everyone just kind of like trusts them automatically.
Exactly.
Yeah.
I feel like
Same here.
Oh, go ahead.
No, you're good. Go.
I was gonna say, I feel like a big part of like being on externships too, like you're introducing yourself as a student doctor, so they already have to like find that trust in you. So if you come in there confident, even if they don't even know if you know what you're actually talking about, but of course we do. Yeah. Of course we do. But like, if you come in there with such confidence towards the end, they're like, you know what, like, thank you. Like, I really trust and understand what you're telling me. So
yeah. And I think it's also just like not even about being confident, but just also how you present yourself to the patient. Like if you come in all mild and meek and kind of scared, versus kind of coming in and like dominating the room and like making sure like, oh, like I'm happy you're here. Like what can I do for you? And just kind of being confident, like you said, and kind of following through that pace. And even if they ask you something that you don't know, still just kind of answering to the best of your ability and saying more like, oh, I can go ask, or I will look that up, or something like that.
Yeah.
Exactly.
And I think too, like it's not like saying fake it till you make it in like a bad way, but there's something kind of to be said about like, you know, backing yourself. Like if you don't believe in your own ideas, why should anybody else kind of thing? So like, I don't know, if you don't know an answer, like I've seen a lot of doctors, if they don't know an answer, they're just honest. They're like, I don't know the answer to this. Like, let me look this up or let me research this more. And just being confident about that and not being like, ooh, yeah, well, maybe, or like, I don't know. I feel like that's something that I've learned on externships too, is that you're not always going to have the answer.
Absolutely.
Yeah, for sure.
Even going up to preceptors, like you don't have to know every single thing. Like they know that you're there to learn. So I think even just being confident in front of them and being like, well, this is what I found. I'm not too sure maybe what this part means, but like this is the data that I have and this is what I'm thinking along the lines of. I feel like that's been helping the past 2 weeks from when I've just started.
Yeah, no, that's definitely what's kind of worked for me too. Like if I don't know, I just say, you know, this is what I do know, or this is what I do think, but I'm honestly not too sure, because that's what we're on externships for, is to learn. And it's like I've seen a lot of things that I've never seen before, like at school. So it's always still a learning experience.
And I feel like you get more respect from your preceptors too when you kind of admit like, hey, I don't know everything, but like, here's what I do know.
Yeah, for sure.
Thing.
Yeah, I agree. And, you know, I think a lot of people do hold themselves back because they feel like maybe they do need to know everything before they speak. But I think we all know that's not realistic. We're never going to know everything. So
Exactly.
Yeah, that's what I kind of keep like trying to remind myself, that I'm never going to know absolutely everything, and that's totally okay. And I feel like that's a huge part of like tying into that like confidence factor.
Yeah, for sure. And I'm also a person where I don't like, if someone asks me a question on the spot, my brain just kind of goes like silent. There's nothing in there, no thoughts. So it takes me a second. Like I have to kind of like think through things a little bit more than maybe some other people. So sometimes if my preceptor does ask me a question on the spot, I'm just like, give me like 5 minutes, like let me go sit down and like think about this, and then I'll come back to you.
Absolutely.
Like what I think in my answer. So that's also okay.
Yep, I'm the exact same way. They tried to quiz me last week too, and I was like, wait, give me a second. I did have the answer, but I was like, you have to give me a second to really think about it. So
no,
I'm
right
I
there
know
with you
this,
guys.
but it's just like I guess I get a little nervous or something, and then it's literally just like flat line in my brain. Like there's not a single thought in there at all. So
that's how I get every single time. Like I just like black out sometimes when they ask me a question. Like we do right now at the VA, we're doing like grand rounds, and some of the preceptors like to ask questions during it. And like I get so nervous sitting there because I'm like, oh my God, they're gonna ask me a question and I'm gonna black out, and then I'm not gonna know the answer because I'm so nervous, and I'm just like, I hate it.
But it's also nice seeing like that the doctors also don't know everything. I think like you kind of already kind of touched on this too, but I like remember going in and they were like, you can honestly teach us stuff that we don't know because like you are just fresh out and like learning and a lot of newer stuff we haven't seen in a while. So I was like, that is true.
Yeah.
So,
I love when preceptors like are upfront about that instead of just being like, oh, I know everything, like wanting to learn from you. And I think I also really appreciate when the patients are like, oh, well, like you're a new doctor, like maybe take the aspect of you are learning new technology, new things that are coming up. Like you might have a better idea of how to treat something versus like something that's been treated for 15 years. Maybe there's a new drop that you're more likely to use than someone else.
Yeah. And I feel like that's such a good quality of like some of the preceptors that I've experienced is they're willing to like learn from us too. Like not only them teaching us, but they're like, hey, like I know you just got out of all this didactic stuff. Like I'm willing to learn from you too, which I think is a really great quality for some of these preceptors to have. And I think it just really helps with learning in general.
Yeah, for sure.
It's nice to know that no matter what, like even when we are graduated working for years, like we're always going to be continuing to learn something. So it's
and that's the exciting part about optometry too. Like it's so much things are coming out like every week. There's something new or some new research about some kind of new medication, not even for the eye, but so we're lifelong learners.
Yeah, that was literally what I was just about to say. That's like always my big quote is that in optometry, well, in any medical profession, we're just lifelong learners, which is kind of fun.
Keeps you on your toes for sure.
Yeah. But it's like confidence is, you know, kind of like a skill, not just like a personality trait. Like you can kind of practice it. I feel like starting out, I probably had a little bit less confidence than I do now. And so something that you definitely kind of learn like over time. And I think that's really important.
For sure.
Yeah, definitely. Okay, so kind of talking about externships and stuff, we only have like 4 weeks left of ours until we're done. And you just started yours like 2 weeks ago. So do you have any questions for us about kind of things we've experienced or any advice? Because I know a lot of third years are probably starting to go on to their externships. So it might be helpful for not just you, but everyone else listening as well.
Yeah, it's for sure. One of the big questions I always think about is like, I guess what's the biggest advice you would give a third year that's going into their fourth year?
Yeah. Do you want me to start or you want to start?
It doesn't matter. You can start if you want.
Okay. The biggest advice. I would say just go into it with like a super open mind and be willing to learn. I feel like there's like at least some of my externships, like when I started, I knew I was throwing myself into something I was uncomfortable with. And I really wanted to make myself uncomfortable so that I could learn and grow more. So I think just really being open-minded and, you know, putting yourself out there and doing the most you can to learn, always asking questions. And if you don't understand something, ask your preceptor, be like, hey, I don't really understand this, or I don't know what I would do in this situation. Can you explain to me what you would do? Because eventually you're going to be the doctor making the decision. So I think that's something that's really important to think about as you're heading into your fourth year.
It's a good one.
For sure. And I think also like, you know, on the flip side of that, like, yes, ask if you don't know, but if you do know and like you have an idea of what you want your treatment plan to be, or you want to run this OCT, or you think you need to run this visual field, tell them that. Like you are there to not only learn, but also to be a doctor as well, and kind of take the knowledge that you have learned and the experience you do have and keep kind of pushing on that and playing on that. So if you have a patient and, you know, the doctor doesn't suggest to run an OCT, but you think it would be really helpful, just say that, like ask them. And in my experience, they've all said, yes, like go ahead.
Yeah.
So I think that they also do want kind of your advice, and you're not just there to kind of collect the data anymore.
Yep.
But actually make like those clinical decisions and like suggest what medication you want to use, even if that's not the one that they would use. Because I feel like at every site that I've been at, every doctor has used a different medication to treat like one specific disease or pathology or something. So there isn't just one right answer to anything. And kind of taking that knowledge and using it and keeping it in your bank so that when you are alone, you kind of figure out, which medication you do want to use for that, and like why did they use that, and kind of using that. So
Yeah.
like that would be my advice.
No, that's great advice from both of you. I feel like that's definitely something I'm trying to like keep in mind, is that like we're now transitioning into the phase of like literally treating and being the doctor. I think it's so easy as a student to get caught up and feel like, okay, well, I'm doing what I'm told because we're in school. It's like now we're like not in school. We're like in, we're in real practices, real offices, seeing real patients. So it's like, now I need to take that next initiative and be able to be that like, okay, this is what I think the diagnosis is. This is what I want to do. So I think that's great advice.
Yeah. And even if you're wrong, like, who cares? Like, at least you put yourself out there and you're like, this is what I want to do and this is what I think should be done. I mean, they'll tell you if you're wrong, but they also very, very well might be like, wow, that's really great. Like, I think it just shows like the initiative and shows that you're really critically like thinking.
Absolutely.
For sure.
Well, going off of that, what was your favorite site then, and why was it your favorite?
Oh, that's hard.
You can start this one.
I was at one site for 6 months, and then I went back to school, and then I had another site for the winter. And both of those sites were private practice, private equities. And that's what I want to go into. That's where I've kind of always seen myself. And both practices worked differently, but I love them both for like different kind of things. So I feel like I can't really choose between them because I learned different things at each one that I kind of took with me. So at my first one, it was pre-optometry in Roanoke, Virginia. And, going into it, I was a little nervous about kind of, doing my own thing and kind of taking that initiative. And they just made me feel really comfortable, and did kind of ask like my opinion on things so I could actually be confident in making my clinical decisions. So that was really great. And the staff was wonderful and kind of helping me get started. And then my other one was my eye doctor in Wilmington, North Carolina. And I saw a lot of different diseases there, which I was a little surprised about. And I also got to learn different skills and techniques. So I got to do amniotic membranes and dilation irrigations and things that I hadn't done previously. And they kind of took the time to help me learn that, which was really nice. So every place is going to give you something different, and you're going to take something away from every place. So
I resonate with that a lot too, because I didn't do a combined like Mackenzie did. So I did a 6-week and then I went to another one after that. But my 6-week one was a lot of pediatrics, and I was so nervous for that because I was like, oh, I don't know that I really want to do kids. I don't want to do all this BV. I was genuinely so nervous about it, and I wanted to put myself in that uncomfortable position, and I ended up like loving it, and it was great, and I learned so much while being there, and I love that a lot. And then my next one was in Charleston, South Carolina, and that was family vision care. And that one I really loved just because I got to learn a lot about dry eye management and things like that. So I actually got to do a little bit of IPL. There was some other students with us. And so we got to do IPL on each other, which they tried to put the one student tried to put the shields in my eyes, and
I know that didn't go well.
No, I'm it was me, not her. It was literally me. I'm notorious for being so bad with anything being like put in my eyes. Like doing gonio in school was traumatizing to me.
Lisa is the problem.
No, I am, and I'll admit it. I'm 100% the problem. But it was really fun to learn like doing IPL and stuff like that. And then my one I was at before the VA that I'm at right now was Fayette Regional Eye Care. Shout out Dr. Ross. And he helped me learn so much about dry eye, and it was also my disease site. So I got to see a lot of different things there as well. But I did IPL a lot with him, which was so fun. We talked about on a previous episode doing the IPL and like meibomian gland expression. Like we did the manual expression after that, which I loved. But it was just a really great site. I learned a lot, and I kind of was not looking forward to that site as much originally just because it's kind of in the middle of nowhere. But it was a lot of, like, I had a really great time there, and that was one of my favorite sites. And I honestly do like my VA right now, I'm learning a lot. I knew that this was going to be an uncomfortable setting for me because, like Mackenzie, I am going to be in private practice, not like a hospital setting or things like that. But I think the VA has really pushed me to learn a lot more and see a lot of things that I have never seen. So I've really enjoyed that aspect of it too. So I don't think I could really pick a favorite, but there's a lot of good ones.
All of them for different reasons. Got it.
And okay, I'm just gonna go ahead and say it. The first like couple of weeks there, you might think you hate it because it's just so like awkward getting there. Like you don't know anyone, and like I don't know, they're used to students kind of coming in and out, so it's always kind of like a period of transition. But I have ended up loving everywhere that I've been. So don't just go that first week and be like, oh my God, this is gonna be the worst 3 months of my life, because typically I feel like it's kind of turned around and like gotten a lot better.
Definitely.
I'm super excited. Like the one I'm at right now is really, really good. It's a private practice, group practice setting, but it literally gives me my own like exam lane to work out of. I have my own set of patients. Like it's really, really cool. So it's helping me really get into the groove of feeling like a doctor, because I still don't really feel like that's about to happen in the year. That's been nice. But I'm excited for like the future ones too. I think they're all going to be very challenging, especially my last one, my VA. I think those are going to be very hard, but I'm excited.
It's fun. It'll go by so fast. It's
perfect.
It's crazy.
Just keep an open mind, and like Mackenzie said, the first few weeks you might be like, oh my God, I'm going to die here, but then you might actually end up loving it. So.
Well, going off of that too, what was a moment during your 4th year where you felt super lost, or like just not you don't feel as great or as confident, and what did you do to recover from all that?
Do you want to go, Lisa?
You can go first for this one. Okay. I'm trying to think of my
answer.
I'm
trying to think too. I don't know. I feel like, so I am a shorty. I'm very short. And BIO, it won't be my weakness till the day I die. So I feel like I still sometimes struggle with that. And at the private practices, I honestly we didn't dilate a lot of patients. We took photos on pretty much everyone. So I wasn't doing like BIO every single day. So then when I got to the VA here, I already wasn't fabulous at it, and then I hadn't done it in probably, 6 to 8 months. So then it was real rough getting back into it. So I don't know, I just constantly am trying like different views or having them tilt their head a different way. Just trying and kind of get through that and figure out kind of what's best for me. But I'm not gonna lie, I still I'm gonna try and take fundus photos on every patient that I can.
I feel like you need to give yourself more credit though. I feel like you think you're really bad at BIO, but you're not. Like we practice together so much.
I know.
I remember those days. You can do it.
My biggest problem is I can get a view, but then I don't see anything. Like I can't see like the detail of something. Like the other day I saw a tuft and I was like, oh, it's a little gray, like round little circle there in the retina. But then like I didn't see the detail of it. So I feel like that's something that I'm having to kind of figure out and work through, is like taking the time to like hold the view and like really get a good look at it, no matter if my patient is like dying behind the lens. Like, it's okay. It's okay. And I think sometimes for me, for me too, like I know someone's coming to check behind me. So like I feel bad like cranking up the lighting and like holding them there for so long when someone's going to have to come and redo it all over again. So I just need to kind of get past that part. They only have to do it one time a year. So like if they're blinded for a little bit, it's okay. They'll never see me again. So.
I feel like we are at such a disadvantage because I'm really short too. So it's like hard when you have these tall patients. You have the chair all the way down. And I'm like on my tippy toes.
And I'm like swaying back and forth, and I'm like, please don't fall in their lap. Please don't fall in their lap.
BIO I feel like is though the hardest skill. And I know, I agree. There are some times where I just can't get a super clear, distinct view of what I'm seeing. Like I know I see something, but like I
I
don't.
don't know. I can't really tell what exactly.
It's tough. And I feel for you too, because I feel like I think about the patient a lot and I'm like, oh, I feel so bad because like they've been stuck like with this light in front of them this entire time. And I know I'm taking forever, but like I'm also trying to practice getting a good view. So I'm like, I kind of need to do this.
Yeah. And then the doctor comes in there and they're like, oh, yeah, it's right there.
Seconds, yeah.
So like,
how?
What are you talking about?
Yeah. Yeah.
And like with my tuft, he was like, oh, and there's some atrophy around it. I'm like, I saw the gray tuft, but I didn't see the detail of the atrophy around it. So I don't know. It's okay. It'll come with time. We're not even a real doctor yet. So it's okay. They have like, I don't know, 15 or 20 years on me. I'll be great by the time.
I mean, that is true. That is true. They do have a lot of years on us. So, okay. So now mine. Well, okay. So I guess this isn't technically like 4th year, but I'm on my 3rd year, like 6-week externship. Whenever I was at that like pediatrics binocular vision site, I felt the first like week or 2, I felt completely lost. Like I was back doing NRA, PRA, FCC.
Trauma.
Like, I was literally, oh my God, I prism bars everywhere. Like I felt so uncomfortable. I think I probably cried the first day. I know I cried the first day when I was coming home. I was just so overwhelmed. I like completely felt like I just couldn't do it. The first day was so overwhelming, even the first like 2 weeks. But obviously you have to stick with it. And I did. And you get more comfortable with it. I think repetition is key too. Like I was doing all those like binocular vision skills on every single patient that I got really comfortable with it. And it all started to come back, you know, when you're doing like our 35-minute practical and you have to do all that stuff every single day under time constraints and everything. It just becomes muscle memory. And I feel like it came back, but it did take a little bit. So I feel like I felt really lost during that time. And I was scared that I was going to literally like do so horrible. And my preceptor was going to be like, what are you doing? And she was right there alongside me. And she was a great teacher. And she didn't fault me for anything. She helped me learn. And I felt like it was just a really great environment. And I don't know, I felt like that's why I ended up actually liking the site, because I grew so much there in such a short period of time. And I was able to get those skills back, which was really great and an important skill to, you know, upkeep, which I haven't done much of that recently. So.
I love that though, because I feel like I'm also doing a 6-week and then I'm going back to TEI in the summer. So I'm just like, this one is so short that I want to make sure that I get a lot out of it, because I'm scared of like, I feel like I'm going to get super comfortable by the time I'm ready to be done. And I'm just like, dang. So
I feel like it's like that for all of them though. Like as soon as I start like getting in a groove and I'm like, okay, like I know what I'm doing, I'm going to keep doing, like I have my flow, and then it's like, oh, time to leave. And then you got to go learn a whole new EHR system and a whole new, like they're all different. Like it's, I don't know.
The EHR is the worst.
It is. I'm not even going to lie. I do not like the one that I have right now.
Yeah. That's the thing that slows you down in the beginning at first, like so much, is literally just the EHR system. It sucks learning a new EHR system.
I'm just trying to figure out they have diabetes. Where is the history at? I'm like, I can't find it. Like, and then I'm trying to find VAs because they have techs there too. So the techs do everything, like all the entrance. I mean, you can double check if you want, but like I have to go and find their notes and then find the previous doctor notes. It's a whole mess.
And it's okay. It stays like that. So I feel like the only time you'll start feeling really comfortable and like be able to figure out the EHR is when you start your actual job, because other than that, it's like the last week I'm learning something new that could have been so helpful and like saved so much time 6 weeks ago when you started. So
pretty much.
And then my last question is just like a combined question. So first part is like, how do you feel going, about to be doctors in literally like a month or so? Do you feel like externships like helped you with that? And then are you doing a residency? Why or why not?
Okay.
Yeah. So I'm not doing a residency. I want to just get out there and start working. I feel like I am in so much debt that I'm like, I just want to get out there, and I feel like I'm ready for it. I'm nervous. Like, I can't believe we are already to this point. I just feel like looking back 4 years ago, I'm like, I literally knew nothing, and kind of see the progress of like where like we've all come is kind of crazy. So I think that gives me a lot of comfort in knowing that like we are ready for this and I'm ready for this. I think it'll be a transition, but I feel like I'm ready to get out there and start out on my own. It's just going to be I'm a little bit nervous, but I feel like it's a healthy nervous. You know what I mean?
Yeah. I don't feel like we're ever going to feel like 100% ready.
No.
Like, I feel very ready, but then over the past couple of weeks, like, as I'm starting to like decide on my job and like sign for it and like think about my start date, I'm like, wait, like, there isn't going to be anyone that's going to come checking. Like, I'm just going to see the patient and then I can tell them to leave all on my own. Like, it's, I don't know. I feel a little nervous as well, but I think it's impossible not to feel that way.
Yeah.
I'm also not doing a residency. I just feel like I just kind of want to do like private practice, primary care with like a little bit of specialty.
Yeah.
But the great thing about kind of the jobs that I've been looking at is they are really great on, you know, if there is a specialty that I want to learn that they offer there that I don't feel comfortable with, they're going to take me under their wing and teach me how to do it. So like the practice will have dry eye and things like that. So I'm going to North Carolina. So I can't take the North Carolina boards until August. So all summer I'm going to kind of just being like shadowing them and like them teaching me the dry eye treatments, because none of my externship sites had that. Or like scleral lenses, like just kind of slowly kind of getting me into that. So I think if, you know, you do want to just go the primary care route and you feel okay, there are offices out there or opportunities that you can find that they're not just going to throw you right in there and make you do everything. Like, they can kind of slowly work you in. And I think that's kind of what they expect too. They were there at one point. So
yeah, that's what I like about the place I'm going to be working at. There's other doctors there that I won't feel like alone when I'm, you know, or like I'll have someone to collaborate with if I feel like I need. Yeah. And they have a lot more experience than me. So I feel like that's something that I really valued while looking into like where I wanted to be too.
Absolutely. For sure. I feel like you guys are kind of in the same boat as me. Like you're about to do what I kind of want to do too. So it's exciting to see that, like, you say like externships was enough and to get you where you need to go. So that's exciting.
It is. And it's, you know, we're all, like we said, we're always learning. So like, it's impossible, I think, to feel 100% ready. But just as long as you can, you know, the elements of the exam that you need to do, there's always going to be a walk-in that comes in and you're like, oh, I've never seen this. Like, what do I do? But that's what the Will's Eye Manual or, you know, other doctors that you make connections with are for, to kind of get you through that. So,
and your friends in optometry school too.
Yeah.
So be like, hey, this case. Or a lot of my preceptors have been like, if you ever need to reach out to me with a case, like, let me know, like, we'll help you through it or something like that. So
and I think that's the cool part too. Like, everyone in your class is going to go down different paths and different routes, and, you know, some of them might specialize in anterior segment. So if you have something that comes in, just text them. And I think that's kind of what's great about PCO is each class has kind of gotten to know everyone in it. So like, I know pretty much everyone, and I think I would feel pretty comfortable like reaching out to someone if I needed to, and not that I've never spoken to them before.
No, I 100% agree. That's that's one thing PCO I really do appreciate about PCO. Like the community there is great. So
yeah, you make lifelong friends. Lisa. Okay, well, if you don't have any more questions, I have a clinic confession that I want to talk about, and this one kind of caught me off guard just a little bit.
Let's hear it.
Okay. Let's hear it.
So this case is definitely one of those where the patient walks in and you're thinking, oh, this is going to be quick and easy in and out.
Famous last words.
Don't ever think that, because it's never going to be that. I learned that the hard way too.
So this was complete opposite. But what was kind of weird is, so it's at the VA and there's something called like a C&P exam. So it's where a veteran goes and gets an eye exam to determine like the disability or stuff like that. So they had a full eye exam literally 2 weeks before they came in. So that's why I thought that, because if they just had an exam, what would be different in 2 weeks? Well, there was some differences. So, so he came in. It was an older gentleman, but he still had no complaints. Like, he was doing great. So with the C&P exams, they can write the prescription, but it's not like officially signed. So they basically have to come back to get another refraction. So the refraction was the same. It improved his vision. He had like literally no complaints. He was doing great. So it was pretty easy at the beginning. And then, yeah. So he was diabetic, and he also has been on like some radiation treatments for cancer. So we wanted to just get like some OCT, just the baseline scans, since he was new to us. And well, I'm just taking the scan, and something popped up.
Oh boy.
So I'm like watching, we have the Heidelbergs, I'm watching it like come through on the screen, and there was like this subtle little hyper-reflective band in the inner retinal layers. Like, it passed by, and I was like, I need to go look at that before I continue this. So.
But wait, no, like, he had no like blur, distortion, like.
No.
He had no symptoms.
No, nothing.
Okay.
He had no symptoms. And they had done an OCT at the exam before, so I requested for that to get sent over so that I could see if it was there. It was not. So this literally had popped up in literally 2 weeks. This was no clinical findings, purely OCT. So if I didn't do the OCT, I would never have seen this. But before I move on, Lisa or Kylia, when you hear like a hyper-reflective lesion on the OCT, what's kind of like going through your mind? Like, what would your kind of differentials be?
Usually like ischemia, so like a cotton wool spot. Those are like in the nerve fiber layer.
Yeah.
And then like, I think artery occlusions can give you like a hyper-reflectivity too.
Yeah, so that's ischemia is kind of like the big thing that kind of jumps out in my brain. So I was like, okay, something's going on here. But it was in like the inner retinal layer. So it wasn't on top like a cotton wool spot. Right. And then it wasn't the whole thing. So I knew it wasn't an artery occlusion. But when I looked at the scan, I immediately thought, wait, I've seen this before. Because in my first rotation in like July-ish, I had a patient come in, but she had a central blurred spot. And when I did the OCT, I saw this. And my preceptor didn't, like, she had never seen it before either, so we didn't know what it was. And we ended up like talking with like retina about it, and getting her the help she needed. But I still didn't have like a definitive diagnosis of what it was.
I think I remember you talking about this case back in the summer.
I literally sent this picture in the summer to everyone I knew. What, like, I could not figure out what it was. But at the VA, they knew exactly what it was. So it's called paracentral acute middle maculopathy, or PAM. And I went back in our notes, and we didn't learn about this like in school at all. So have either of you heard of it?
Nope.
No, I've never come across it. No.
It is ischemia, but it's in the deeper retinal capillary plexus. So it's only affecting the intermediate and the deep layers. So it's not affecting the superficial like vessels at all.
Okay.
So it is kind of like, an artery occlusion, but that's for all the layers, and this is just like the very fine, deep layers.
Yeah, so that, I guess that makes sense why that, you have that hyper-reflective band right in that inner nuclear layer.
Yeah.
On the OCT. Did you guys also get like a OCTA, and what, like, did that show any like non-perfusion?
Yeah, so it was, it showed areas of flow void in the intermediate capillary plexus and the deep. But then the superficial, like, it still had the vessels going over, which was really kind of cool to see, to click through the different layers. But what's really important is that PAM, it's not just like a random retinal finding. It's actually considered a really early marker of retinal vascular like compromise.
Oh boy.
So you want to think of it on the same spectrum as like a retinal artery occlusion, just earlier and more subtle.
Interesting. I was going to ask, what do you think caused that?
Yeah, so I don't know. He had the diabetes. We also didn't know if there was some kind of like correlation with the cancer treatments that he was getting. So I think it's just an early, like, kind of normal systemic, like, vascular thing that was going on.
Yeah.
But
I don't know. That's kind of like scary because
It
you
is.
had literally no symptoms. And I guess if you
no,
never looked at the
You
OCT,
would have never
I-
found
if,
it.
yeah, if
No.
you had no indication to do it, you would have never known.
no. And I know, like, that's why I don't know, it made it feel like a really, like, big deal because
Yeah.
he felt completely fine.
Mhm.
And this is, like, the first sign of something vascular that's, like, going on systemically in his body.
Yeah.
But, you know, it's something that where these findings, the eye is giving you a heads up that something worse might happen in the future.
Yeah.
Yeah.
That's really cool.
I'm really
Yeah,
glad you
so-
did that OCT.
I
Yeah,
know.
me too. Especially because, like, if I would have just gotten the other OCT from 2 weeks ago, I would have been like, okay, like, we don't need you that fine. But
Yeah.
I don't know. I'm glad that it ended up working out that we did it because that it turned from just an eye exam to a full body like thing.
Yeah.
So I was like, so do we just monitor this, or is it something we need to like escalate?
Yeah. Because you
Um,
can't just like ignore something
Yeah.
like that.
Yeah,
Gotta
no,
send it to
because
somebody.
yeah, because when I was like talking to my preceptor, it's actually so Pam is the first OCT sign in an acute retinal artery occlusion. So,
No
Mm.
way.
like, this is like a precursor. Like, you're not going to find it in everyone because it's so acute, but it just, he was like at the right place at the right time. He ran the OCT in like the perfect like setting. So, if you
Yeah.
have a patient that comes in with a CRAO or BRAO, what would you guys do?
Bye-bye. Go straight to the ER.
Absolutely, they need a workup.
Yeah.
Stroke, please.
Yeah, so that's the same thing for Pam. So if you see that, you have the same stroke like workup protocol. So
That's
thankfully it was at the
crazy.
VA, so I just walked him right across the hallway to the ED, and he had all that testing done.
That's good.
Yeah. That's such
So-
a big call, like especially when I don't know, it's hard to explain to a patient like you're having no symptoms. You feel like nothing is wrong,
Yep.
but you gotta go to the ER now.
Right now.
Yeah,
Yeah.
I know, and it's like I feel like that's the hardest part, like explaining to like him and
Yeah.
his wife, like I know you feel fine, but we're
Yeah.
seeing something that we really can't ignore. Like it
Yeah.
can cause for concern, like in the future if we just kind of leave it.
Yeah.
Because you know it is associated with the microvascular ischemia from the diabetes or
Mhm.
carotid issues or other
Mhm.
kind of just systemic vascular disease.
Yeah.
Yeah.
And we don't want to miss that window to catch something really early. So
Yeah.
he wasn't having any like signs or like symptoms of a stroke, and
Yeah.
he hadn't in the past 2 weeks, but something
Yeah.
we still wanted to get checked out.
Absolutely.
Yeah, it's such a good reminder that like not all serious pathology comes with symptoms.
No,
So
Yes.
yes, it's like the quiet findings that sometimes matter the most, like which are like
Exactly.
scariest.
how did we not learn about this in school?
Yeah, I feel like that should have
just-
been a big one.
I
Like
know,
what?
I don't know.
I don't know. I just feel like this is something kind of like big. I mean,
Yeah.
it's hard because it is such an incidental finding. Like
Maybe
you're
that's
not,
why.
you wouldn't know to look for it really.
No, yeah,
So-
no, you wouldn't. So I don't know, but it's definitely changed how I like look at OCTs now. Like I just want to
Yeah.
kind of get an OCT on everyone with like systemic risk factors just in case, because like how many
Yeah.
other patients have I seen that I didn't do an OCT?
That
and
might have needed
Yeah.
it.
yeah. So I don't know, but I
Yeah.
just thought it was weird because like I saw that, I know my brain was like, I've seen this before, and I went
Yeah.
back to that other case, which was
Yeah.
really weird. But
That's crazy that
Crazy.
you've seen that twice though.
Yeah.
Because I feel like that's never gonna happen again.
like that's
Maybe
very
this is the
rare.
thing. This is the disease that's like magnetic to you.
Yeah.
You know?
well, at least I know what it is now and what
Yeah.
to do.
That's true. Yeah.
That's
Which that other patient we did end up sending for a stroke workup because the retina specialist said that it was like a branch, like a twig artery occlusion. So,
Yeah.
but I didn't know
Yeah.
it had a special name.
Yeah. I
Yeah.
didn't know that either.
Well, now
I
we
know,
know. So
so
we see it too.
now
We'll
we
know what
know,
to do.
Yeah.
Yes, we will. Yeah. But I don't know. He didn't have any of the stroke symptoms when he got to the ED and they did all the testing. Everything was fine. They
Good.
did just find like 70% stenosis in parts of his
Okay.
ICA and his vertebrobasilar system. So not something that they necessarily needed to treat immediately, but definitely something that vascular is going to kind of keep like following up on and keep a close eye on.
Yeah.
So overall, good outcome, but definitely not the quick and easy visit that I thought it was going to be.
Not
Yeah.
at all.
Yeah, I guess this is our reminder. Routine exams are not always just a routine exam.
No. No, they're not. Literally, they never are. So,
Yeah.
but yeah, I thought that was a fun case.
That is a good one. Thanks
Yeah.
for sharing.
I love that.
Yeah.
And I love to, like, I feel like Mackenzie and I have been able to, like, share different things that we've, like, learned throughout, like, I may have learned something that she might have not have learned, and I'll share it with her, and same thing, like, vice versa. Yeah. So I love just, like, being able to talk to your friends, being like, well, what did you learn, or did you see anything interesting today? Yeah. Because there's so many things that I feel like I've learned, and it's so nice to be able to, like, share with other people. Yeah. And be like, did you know about this before? Because I didn't know about this. Yeah. Like, am I, like, missing something here? And then, you know. So
I agree.
That's
for
always.
Sure. Even though it's only been 2 weeks for us, I feel like a lot of my friends have already seen a lot of crazy stuff. So I'm like, this is really cool to compare notes.
Yeah, it's nice. Because you might never see that, but you still learned about it from them, which is really good. So it's exciting. Part of externships.
Love the collaboration.
Yes.
And then before we move on, we have to talk about something that is actually a really great opportunity.
Yeah, especially for those 2026 grads that are listening in.
Yeah, so especially Kylie, remember this for next year. Yes. Especially Valley Contacts is doing like a giveaway where you can get a free custom stable scleral lens fitting set.
Yeah, which kind of insane considering how useful like that's going to be once you're actually in practice. So it's really nice of them to do that.
Yeah, and it's super easy. You just watch like a short video and then take a quick quiz, and then you can qualify for the free set, which is amazing.
And it's not free drawing. Every 2026 grad who does this will receive this set. It's just sent to your school, and then before graduation, I guess they'll kind of pass it out to everyone. So
yeah, and then plus you're like learning something in the process. So
yeah, and that's why we did want to kind of bring it up, because, you know, we all love a giveaway and free items, but this is something that like is really relevant to practice and useful. So, you know, even if you're not going somewhere who's going to be doing scleral lenses on a daily basis, you know, this is good to just kind of keep in your drawer in case you need it. Just a quick little fitting set.
Yeah, especially with how much specialty lenses are coming up like more and more in clinic. I feel like it's a super great tool to have.
Yeah, so if you haven't heard of the custom stable lenses or don't have much experience with sclerals yet, it's a fully customizable lens, which means you can basically tailor to the fit of each individual patient. So
yeah, which is super huge, especially for patients who don't fit that like standard category, like keratoconus, post-surgical eyes, or even severe dry eye, things like that.
So instead of like forcing a lens to work on somebody's eye, you can actually like design it and tweak it so that it works specifically for them. So
yeah, which when you say it like that, Mackenzie, it sounds overwhelming, but
okay,
I swear it's not.
Sorry, it does. But like we know from working with Dr. Guidish, like Valley Contacts has a really, really good customer service and like consulting specialists, and they'll help you guide you through the process. You just got to give them a call and tell them what you're seeing, and they will help you from there. So I feel like it's not actually that scary.
Yeah, I totally agree with that. I also feel, like we got to see how that process worked when we were working with Dr. Guidish, which was super cool, and they really do help like step you through it. And I feel like their people know so much.
Yeah, and the fitting guide inside, it tells you step 1, do this, step 2, do this. So,
that's helpful.
It's great.
It's very helpful. So, you know, and we did talk about it in the last episode too, how scleral lenses can change someone's life. So just having this at your side, even if it collects dust and you never use it, you literally 10 years from now, you might have a patient that you really need to throw one on, and you need to pull out that set and use. So.
Yeah, exactly. As we know, it's not just about like a vision chart. It's their day-to-day life that kind of matters the most.
Yes. So, you know, for sure. But I don't know. The fitting guide is really great. Goes step by step. So if you're a 2026 grad, definitely check it out. But also they have like a student portal. So if you are in Kylia, you can go on there too. And they have other videos and education tools as well. So anyone that's listening, go check out their website.
It's Valley Contacts with a X at the end.
Yeah. That's what we're tapping in.
Go to the student portal there.
They have a lot of cool stuff, and we didn't even know about it until we kind of started looking in like to their stuff when they started sponsoring the podcast. And they have a lot of things on there that I wish I would have had like 3 years ago. So
yeah, for sure.
It's exciting.
All right. Yes, we have talked about ALOC today. We've talked about the good, the stressful, and all the different learning curves. So I feel like we should do our What I Wish I Knew moment.
Yes. Let's go for it.
All right.
I think you have to start it off.
All right. So if you could go back and tell your earlier self, maybe your first year or even pre-optometry, one thing you wish you knew, what would it be? And it can be literally anything, the smallest or the biggest thing ever.
Yeah.
Honestly, for me, that everything's going to be okay.
Yeah.
Because I feel like it's very much, it's very daunting when you first start optometry school. It's very nerve-wracking. Schedule's hectic. It's a lot going on. So I definitely wish I guess going back, I would just tell myself that like everything's going to be okay. And like to really stay on top of everything and utilize my resources more. Because I feel like a lot of the times we have a lot of things at our fingertips, but sometimes having too much resources feels overwhelming.
Yeah.
So I think just being able to know how to utilize those resources a little bit better.
Yeah. And being able to like lean on other people too. I feel like sometimes people go in and then they feel like they're all alone and they have to figure it out all by themselves. But I feel like it's more of a group effort. Once you kind of get into it and kind of find your people, it's everyone's just kind of chugging along all together and figuring it out.
Yeah, I think especially for like the first years and second years out there, like it's just super important, like you said, Kylie, to just remember that it's all going to be okay. You're going to get through this. It's hard. And if it was easy, not everyone would be doing it. So just, I think that it's kind of cliche, but like it is the truth. Like, you're here for a reason and you can do it. Just surround yourself with people that encourage you and, can help you get through some of your hard times.
Yeah, for sure. And I feel like knowing that would have saved me literally so much stress during biochem. Because after like that first test or two, like I literally have Snapchat memories that come up every year of me just sitting in my bed, bawling my eyes out, and I have it captioned like my first optometry school mental breakdown because I thought I thought that was the end of my world. So
see, that was me with neuro for some reason. Biochem, and I just like clicked. But
see, I needed you then. I needed you to get me through that.
I know. Well, I know we kind of. Wow, I need you to help me get me through neuro.
I did.
Well, you did. It
Team
was
effort.
Neuro was always my my struggle.
Same.
I feel like it was for a lot of people.
Neuro, it tried to take a lot of people out, but
it did.
We survived.
Yes.
Yeah.
That's all that matters.
Yeah. All
right.
Right.
Thank you for sharing that.
Yeah, I feel like that was kind of the perfect way to end the episode.
Yeah, I had so much fun chatting today.
Oh, me too. Thanks for having me again.
Thank you again for being our first ever guest. We're just starting here. You're the first one, so everyone is going to have to talk to you. We'll see if that happens or not.
Yeah, I know. I was really excited to have you on as a guest, so I'm so glad you were here to join us as our first guest. It was super fun and enjoyed talking with you.
Yes, thanks, guys. And I hope this helped everybody that's listening, too.
Yes.
I know. I hope so. That's the goal. So if anyone else is out there listening and thinking they have something to add to the conversation, this is their sign to join us.
That's exactly what Blink Collective is all about, bringing in the different voices and perspectives. So
So, reach out to us, connect with us on Instagram and TikTok, follow the podcast so you don't miss what is coming next. Because this isn't just our podcast, it's everyone's.
So share this with a friend, and remember,
you do not have to have it all figured out.
You just have to keep showing up.
Yep. See you next time on Blink Collective.